This week on the BackTable podcast.
Bullying is the perfect antidote to self-worth and job satisfaction. It's the perfect crime that leaves no visible marks, but effectively destroys one's ego, identity, and resilience.
It's really a waste, and it's really a pity that we, as society and our culture, exclude so many people because of gender, because of their sexual orientation or skin. While at the same time, we're lacking of people that are willing to do surgery. So if we don't change the way that we approach younger people, younger medical students, etc., we will face much bigger problems, and we have to end this toxic environment now.
Hello, everyone, and welcome to the BackTable podcast, your source for all things interventional and endovascular. You can find all previous episodes of our podcast on iTunes, Spotify, and on BackTable.com.
Now a quick word from our sponsor. At Medtronic, they take deep venous disease and patients' quality of life seriously. That's why they've committed to help you treat patients with the Abre venous self-expanding stent system. Risks include pain, myocardial infarction, pulmonary embolus, and restenosis of the stented segment. Learn more at www.medtronic.com/Abre venous. And now back to the show.
Today, we have a very special episode on bullying and harassment behaviors in the vascular workplace, but really overall in healthcare. And we have two special guests who really took a deep dive into this and did a whole study around it. It's an important cross-specialty effort led by some colleagues, vascular healthcare professionals from several countries. And today we have Rachael Forsythe and Dr. Konstantinos Stravapoulas. Is that correct?
You did a great job.
Thanks, man.
Diplomacy.
And so, guys, I want you guys to tell our audience a little bit about yourselves. Konstantinos, we met via Vascupedia, and then Rachel, and then you introduced me to Rachael. But Rachael, I want to start with you. Just tell our audience a little bit about yourself and your background and where you're at today.
Sure. Well, thanks very much for inviting me on the podcast. I'm Rachael Forsythe. I'm a final year vascular surgery trainee in Edinburgh in Scotland in the UK, just a few months off being a consultant or attending. I'm also president of the Rouleaux Club, which is the UK Vascular Trainees Association, and we represent all vascular trainees or people wanting to be vascular trainees in the UK and Ireland. I'm no stranger to podcasts, having done a few with the Audible Bleeding team, and it's a pleasure to be on this one.
Thanks, Rachael. Konstantinos, tell us a little bit about yourself.
So my name is Konstantinos Stavroulakis. I'm Greek, but I work in Germany since 2011. And everybody has problems with my name, so don't worry about it. I'm consultant of vascular and endovascular surgery in Munich, Ludwig Maximilian University. I spent a long time in Münster, where we started the Vascupedia effort. And I think you know the other guys from this project. And we were very interested in doing a survey about the toxic environment in vascular workplace. So that's how we met also Rachael, who did an excellent job in the past in this topic. And we joined our efforts in a common cause to assess this very important topic.
Perfect. Yeah, we'll jump into that. Yeah, we've had Lorenzo Petrone on the show. We've had Theo Bizdes before, other co-founders of Vascupedia. So to our audience, definitely go check those episodes. And also check out vascupedia.com as well as Audible Bleeding, both great resources for the endovascular world. So let's talk about the inspiration behind this study. Maybe you can tell us about what the Research Collaborative for Peripheral Arterial Disease is, RCPAD, and how does it represent several vascular departments across the European continent? Konstantinos, I'll start with you.
Some years ago, we met a wonderful group of people, Hani Zayed, Thanos Sarangis, Isabel Van Hetzele, Professor Torzello, Giovanni Torzello, and Theo Bizdas. And we had an idea that we should build a collaboration among departments, vascular departments, regardless if they're vascular surgery departments, radiologists, angiologists, cardiologists, in order to be able to perform scientific research programs in Europe. And we started 2 years ago. We already published one paper about covered bare metal stent reconstructions for aortic disease in European Journal. And we try to bring together people from different specializations that want to perform any kind of research projects in peripheral arterial disease. I think we have done a good job till now. Of course, we're expanding. There are many programs running till now. And I'm happy to be here with Rachael to present to you one of the recent projects that we performed.
Great. And Rachael, for you, was there inspiration behind the study? What made you want to get involved with this?
So for me, I was approached by the RCPAD team to be involved in this study because I previously conducted similar research with the Rouleaux Club. So the Rouleaux Club, as I said, is the UK Vascular Trainees Association, and every year we do an end-of-year survey which looks at training issues. And back in 2017, one of the things we asked about was bullying, undermining and harassment. And we repeated the survey in 2021, and unfortunately, things had gotten worse in the 5 years. So the levels and the incidents had increased over those 5 years. And I think my understanding is that it was the Rouleaux Club survey data that was partly in a way of inspiring, or was the inspiration behind the RCPAD bullying and undermining and harassment survey. And I think that's why I've become involved. Is that right, Konstantinos?
Yeah, somehow it is. So this was an idea that I had, and then I discussed about it with Thanos because I wasn't aware of your research, Rachael, to be honest. And then Thanos told me about you and your excellent job that you did in the past, and then we decided that given your experience, it would be better to join our causes.
Sure.
But I was quite worried that especially in surgery, the environment in many departments is quite toxic. Mm-hmm. And I think that if we don't change our approach to younger colleagues, for sure we will have many difficulties to find young, motivated people to work in a surgical department. And when we check the literature, we didn't have any compare among vascular surgery, radiology or angiology regarding bullying in the vascular workspace. So when we discussed about it with Thanos, he suggests to call Rachael, and he did, Thanos Aragis. And then, as I said, given her experience, it was, I think, a very good idea. And I think that Rachael will present you the results of the survey, which are quite depressing, I would say.
Yeah, so it sounds like part of the inspiration was you guys have whether witnessed this or experienced it maybe in your training and work environments, and want to and probably or heard about it from colleagues, want to improve the overall culture of vascular training and the vascular workplace. Have you involved anybody from America, or is this purely a European project? Rachael?
Yeah, so the RCPAD is composed of people from Europe. But the way we disseminated the survey was in partly based on social media. So we have had some respondents from the USA. We didn't purposefully contact anyone in the USA. I know there's some research already being done over there, but we certainly didn't exclude any USA participants from undertaking the survey. We did focus mainly on Europe-wide participants.
Okay. And we use some mailing lists from professional societies, and BackTable support us as well. So we use the Vascupedia, registered physicians. Some of them are from the States. Yeah. We have, of course, and Rachael, correct me if I'm wrong, something like 4% US physicians responded. 4% of the responses are from the US. But mainly, RCPAD is a European project. That's why mainly we focus in the European countries.
Yeah, understandable. So yeah, you guys kind of touched on the methods. Surveys were sent out, but can you tell us a little bit more about what kind of questions were included in those surveys and what you guys were targeting with that information?
Sure. So it was an internet-based. It was an international internet-based survey, as we said, of medical practitioners in the vascular workplace, targeting vascular surgeons, interventional radiologists, and also angiologists, although we didn't have many of them respond. And we undertook it really via the various surgical and endovascular societies, with us emailing our contacts and asking for this survey to be included on their mailing lists, and also via social media and also by word of mouth. And we started with the usual questions about demographics, and then moved on to participants' personal experience of bullying, undermining, harassment behaviours in the workplace, asking about frequency over the past 12 months and over the past 5 years, and then their witnessed experience, so witnessing someone else experience these behaviours, again, over the past 12 months and at any time point in their career. And then we went on to ask a bit more about this. Why did they think they were experiencing these behaviours? What was this in relation to in terms of personal characteristics? And what did they do about it, if anything? So we had some options as to the responses someone might have if they experience or witness these behaviours. and whether they had any confidence in the system changing as a result of this, and also things like, did they consider resigning? Did they actually resign? And finally, we asked for some free text comments, and perhaps this is the most illuminating part of the survey, and in some ways the most terrifying part of the survey, actually, when we asked for the free text comments.
And I imagine that's where people gave specific examples of their experiences with bullying and harassment.
Exactly.
Yeah. So let's talk a little bit about the results and what you guys found. Can you guys give us just like the big picture, and feel free to share, obviously like what the data showed, but also maybe some of these examples of how people are experiencing these toxic environments.
Sure. So I'll kick off. I think in total we got 586 medical practitioners from mostly around Europe, 28 different countries, most commonly respondents from the UK, and then, as we said, a couple of respondents from the USA. They were typically, as you'd expect, majority were male, heterosexual, white, and it was predominantly a survey of vascular surgeons. Actually, 85% were vascular surgeons. Actually, interestingly, 57% were consultants, whereas previously we've surveyed, obviously, the Trainees Association have surveyed trainees, but we got a decent amount of consultants or attendings. And I think the headlines are that almost half of respondents had personally experienced bullying, undermining behaviour and harassment within the last 12 months. So 43.1% of the respondents. And that's anything from a medical student right up to an attending and a retired attending as well. This was most commonly when junior as a resident or fellow, but it continued up to and including consultant grade as well. And even worse than that, 75% of respondents had witnessed another colleague experiencing these behaviours, and half of that was in the last 12 months. So this is a really, it's a big problem. It's happening all the time, and it's not an old problem either. And I think the key thing is recognising it's not just a bunch of trainees reporting these problems. This is consultants amongst consultants as well.
Yeah, and you said there's been prior studies in the past that maybe the methods are a little bit different, but or was there a trend? Have you noticed a trend, up or down or just flatline in these behaviors? Konstantinos, have you noticed anything in the data, comparing your data versus prior studies?
I think it's the first time that we really included such big numbers of consultants and head of departments and so on, so it's very difficult to compare them.
Yeah.
But I think, as Rachael mentioned before, I don't think that the situation is getting better. Probably the opposite. What's a very interesting finding, and I think Rachael can also comment on this, is that the biggest problem, the major issue, or the person that was performing bullying were head of the units or consultants.
Mm-hmm.
And you can imagine how difficult it is for younger persons to stand up against their consultants, or to find a way to bypass them in a big hospital and go to the administration or find someone that is going to help them. So when I saw the results, and Rachael, I'm not sure about it, so something like more than 50%, the person who was performing bullying was head of a unit or a consultant, right?
Around that.
But you can imagine, Aaron, if you are a young resident or fellow or trainee or even a young consultant, and you experiencing a bullying behavior from the head of a unit, how easy it's for you to do something, and what can you really expect? So the only thing that most of the times you can do is to leave your job.
Right. Yeah, and just for our American audience who may not be familiar with the nomenclature, but the consultant in Europe is basically the equivalent of an attending, in the U.S. And we call them attendings. You guys call them consultants, but just so for anybody so that they're not confused. But yeah, it's we hear stories. Thankfully, in my program, there wasn't really much of that behavior, but you definitely hear stories out there across the surgical specialties. And so, yeah, what is somebody supposed to do when they experience that? Before we jump into, if you guys have recommendations on that, right now we're identifying the problem. How widespread is the problem? Are there any specific examples of bullying, harassment that you guys can talk about without, being too specific?
Yeah, there's plenty actually, and they're a little bit eye-watering in some cases. Now, we can't talk about things verbatim, so we just have to get broad themes, but right. We broke down all of the free text comments. There were over 450 free text comments of examples of any behaviour that the respondent thought was bullying, undermining, harassment, broke them into domains and themes. And unsurprisingly, there were quite a few with regards to gender discrimination or pregnancy discrimination. The common theme was females being told that they're too emotional to be surgeons, that it's a bad time to become pregnant, that it's very inconvenient for the program. And it's been told by colleagues as well as patients as well, and people feeling dismissed by patients and colleagues on the basis of their gender. And then similar in terms of racial or ethnic discrimination as well. One that stood out to me was someone who needed to attend a funeral of a relative that was happening at short notice according to their religious law, and they were denied time off because of that, and were harassed quite specifically because of their religion. And really terrible examples of patients telling surgeons that it's not possible for them to be a surgeon because of the colour of their skin.
Wow.
Yeah, that really stood out for me, actually. A bit of homophobic discrimination as well. People finding out that they weren't promoted because someone found out their sexual orientation. And then physical characteristics. Someone was told they were too fat to be a surgeon. Someone was told they were too skinny. People are often told, there's lots of unsolicited comments about appearances. And then some quite graphic and expletive-laden quotes as well from people who were just downright subject to verbal abuse, like really inappropriate things that they wrote about, actually. So it's pretty stark stuff, and a lot of sexually inappropriate behaviour, casual sexual jokes, and then actual sexual harassment that, if you read the comments, is clearly illegal, and that the perpetrator could be arrested for some really terrible things, actually.
Wow. Yeah, that is pretty eye-opening. And so what, and you kind of touched on this, Konstantinos, but like a lot of people don't have options to just leave. It's not just like a normal job, right? I mean, we're pretty committed to these positions. We've gone through a lot of hoops to get, into a program, for example, a training program, especially if it's a more elite program. What can people do? Do you guys have any guidance or information for those who might be in a similar situation out there listening to this? Do you guys have any advice, or do you provide advice in this study for what people, some options for people who are experiencing this? Konstantinos?
So, Aaron, to be honest, I don't think that's the solution is to leave your workplace. I think that's the only thing that many people do. Because at the end of the day, these people that face bullying or harassment in their work, they are the victims. So it's very sad. I'm not sure how things are in the UK or in general in Europe, but my experience from Germany is that there is no clear way to defend yourself, even in the institutions. And that's why I mentioned before that it's quite difficult when the head of a unit is your problem. How can you solve it?
Right.
Now, regarding your comment, if you could suggest something, this wasn't the purpose of the study, so I cannot really say something. But I remember some emails sending us from some colleagues asking for help. I'm facing bullying from this colleague or another, and also mentioning names. So I'm pretty sure that the situation was quite bad. And as they were sending us email asking for help, but we cannot really help them. It was like a survey that we won't have a screenshot of the current situation in Europe. But in my personal experience, till now, there are not so many things that you can officially do, at least in Germany.
Yeah. Rachel, anything to add to that?
Yeah, I've been thinking about this a fair bit recently because of the Rouleaux Club survey. We've got longitudinal data that tells us that it's getting worse in the UK, or it's being reported as worse in the UK by vascular trainees. Now, it's small numbers. And very understandably, some of the criticisms are, well, it's fine to talk about it and do surveys, but what are you going to do about it? So I've been thinking quite a lot about it and the reasons why it's happening and what we can do about it. And I think the first thing is that we are owning it and we are talking about it, and that's the first step. But more has to be done than that. And it's got to be at a personal and institutional level as well. I think the societies have responsibility to signpost people, not to mediate and deal with it. But there are always in healthcare organisations and in societies, there are pathways to deal with this sort of problem at the HR level and above. But I think one thing that I've seen recently, which has just come out, is the American College of Cardiology policy statement. on building respect, civility, inclusion in the cardiovascular workplace. And it was literally just published a couple of weeks ago. And it's gone through in great detail why these problems and behaviours are a safety issue and a problem with our workforce that needs to be addressed. And they've just taken it and taken things step by step and told us why we need to worry about this and what we need to do about it. And they've got some nice schematics with regards to reporting and dealing with these behaviours, about confidential mechanisms for investigating the behaviours, creating institutional resources, collecting data, and getting some independent evaluation of the culture in each unit. And also recognising good behaviour, because, it can't always be a bad news story. I think we got to recognise the people who are doing things well and try and emulate that. And just in general, one thing that stood out to me is how it's got to start on an individual level as well. And we all learn our behaviours from people around us. So we are, from medical students who mature into these healthcare professionals who are completely involved in the culture around us, the norms that we are experienced to, the beliefs and values of people around us. And when they change, then we will change. So I think it's really got to start from the very beginning. We've got to look at ourselves, we've got to look at the institutions, and we need to have all those things in place. But there's certainly there's good work happening at the moment, actually, and I would really recommend listeners to refer to those ACC policy statements, actually, that are just out.
But I think that, Rachel, sorry to interrupt, it's clear the situation is very different among different countries. So I can imagine that in the UK or in Germany or in the States, it's easier to find a solution to guide you through the system or somehow, rather than South Europe or other Asian states. So it's also a very cultural thing.
Right.
And this is not result of the survey. It's my personal opinion. But, I studied in Greece and then went to Germany. And I think that there are many, many different cultural differences. So I'm pretty happy that in Germany, sexual harassment jokes are not allowed in the OR or in general. But it was the case when I was a student. So I was hearing them the entire day. And if we're fair, I was also repeating them. So somehow I had to mature enough to understand that this is a situation and a behavior that's it's not acceptable. And Rachel is absolutely right. We have to change ourselves. This is the first step. And then, of course, we have to involve administration, societies, etc., to help the people that are in help, that they need help.
Yeah, those are great points. And you're right, Konstantinos, maturity has a lot to do with it. And making, and our trainees are impressionable, right? So if they were abused, then a lot of times that abuse carries on because that's what they were impressed upon. It's almost hardwired into them that's okay as they go forward as consultants or attendings. And we've talked about that on, there's a great podcast called Operate with Zen by Phil Pierazio. He's a urologist who kind of touches upon that, how you just have to, much like what Rachel was saying, like you have to have good role models in your training so that you can emulate them in the future and also talk about the bad stuff that's happening. So if you can't raise awareness and you just push everything under the rug that happens that's bad, then it's just going to perpetuate. And so, what you guys have done with this study, raising awareness, reflecting on the problem, and talking about it, and then hopefully we can see presentations at conferences and societies so that we can all openly talk about it and know, okay, this is an issue. Let's make sure it's trending down and not up, and goes away. So I really appreciate you guys coming on the show. Any final thoughts before we wrap up, Rachel?
Yeah, I think just one other little thing that's come out of me thinking and reading into this a bit more is the idea that this the uncivil behaviour kind of clusters. So where there's bias and discrimination and a lack of diversity, that often breeds uncivil behaviour. And if we look at the changing demographic of our workforce, I think we're getting more diverse, and I think we want to reflect society a bit more. And as that's happening, people don't fit in and people don't follow the same path, and people don't feel necessarily like the new trainees, the new vascular surgeons are the image of themselves. And perhaps that is one of the issues. So if we encourage diversity and embracing diversity, hopefully those behaviours will start to dissipate. So I thought that was a really interesting point that I'd read about, actually.
Yeah, and that goes with, sexual orientation as well, right? Because, you're talking about gender discrimination and homophobia, that being part of the workplace, like that all, we need to kind of get rid of all that. And so how do we, diversity helps improve that, because
Exactly.
a lot of it is based in fear, and the fear is because you're not familiar. It's the unknown. So
Exactly.
the more people you know of that race or that sexual orientation, chances are your fear is going to go away, and you're not going to be fearful of it.
Yeah, I think you're right. And there's also, if you don't mind, a little quote that I, again, saw in a paper from the Annals of Surgery that it really resonated with me. And these guys said, bullying is the perfect antidote to self-worth and job satisfaction. It's the perfect crime that leaves no visible marks, but effectively destroys one's ego, identity, and resilience. And that was by authors Pye and Cochrane in 2019 in the Annals of Surgery. I think that's it. It's the perfect crime, workplace bullying among surgeons.
Yeah, I agree. Well, thank you for sharing that. Konstantinos, any final thoughts before we wrap up?
So now, now I'm consultant. We're discussing a lot in the staff, how we're going to recruit new residents, trainees, etc. We are struggling to find people willing to do surgery. And I think it's really a waste, and it's really a pity that we as society, not we as a department, but as a society and our culture, exclude so many people because of gender, because of their sexual orientation or skin. While at the same time, we're lacking of people that are willing to do surgery. So I'm not sure how things are in different departments, different specializations, but if we don't change the way that we approach younger people, younger medical students, etc., we will face much bigger problems, and we have to end this toxic environment now.
Yeah, agree. And I think that's a great way to summarize the purpose of the study. And thank you guys so much for coming on. Again, to our audience, if you guys haven't checked it out yet, check out vascupedia.com. Martin Schrader was another guest that we had on recently, another contributor or co-founder of Vascupedia, right? So we love working with y'all, and hopefully we can collaborate going forward. Rachael, it's so great to have you on the show. And also, audience, Rachel's been on Audible Bleeding, the vascular surgery podcast, a number of times. So definitely keep look for her episodes. Thank you to our audience, and we'll see you next week. Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritts, and co-hosts
Chris Beck,
Sabine Dond,
Michael Barraza,
and Ali Behetti.
Our audio team lead is Kieran Gannon, with support from
Caleb Hodson,
Josh McWhirter,
and Ness Smith-Savadoff.
Design and digital marketing led by Brian Schmitz.
Article and transcript support by Taylor Robinson.
And Delaney Aguilar.
Social media and PR by Ann Dang.
Intro and extra music is Ripperoo by Skeptic Moon. Find us on Spotify or at local live music venues in New Orleans, Louisiana.
Thanks again for listening, and see you next week.